So you may have been diagnosed with a hiatal hernia. You could be wondering, what the heck is that? And what do I do? In this video today, we'll do a deep dive about a hiatal hernia. We'll discuss exactly how do we diagnose it, what are symptoms of this, and at the very end of the video, I'll give you my recommendation on whether you should get your hernia fixed. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. I'm a board certified gastroenterologist trained at the Mayo Clinic in Seattle Gastro for all your GI needs, and consider subscribing to this channel. So what exactly is a hiatal hernia? Well, let me clarify some falsities that are out there. So a hiatal hernia is very different from an abdominal hernia. So abdominal hernia is one that you can see, it's an outpouching in your belly from obesity, but a hiatal hernia is where the stomach goes above where it should be, inside your guts. So you have this thin layer called the diaphragm, which separates the esophagus from the stomach. And there's a small little hole that allows the esophagus to pass through into the lower part of the abdomen in the diaphragm. Now, sometimes that diaphragm hole can become bigger, and that causes the stomach to go up into the upper part of the esophagus, where the esophagus is at. And that is when you can have what's called a hiatal hernia. So how do you know if you have a hiatal hernia? How exactly do we diagnose this? Well, there are a couple different ways. So number one, we can do imaging tests. Sometimes a CAT scan or an x-ray can allow us to see that hernia that's there. It can see that outpouching of that stomach up into the upper part of the GI tract. But the most definitive way to find if you have a hernia is to do what's called an upper endoscopy or an EGD. This is where someone like me, a GI doctor, can go down with a scope and actually physically see that hernia. So we can tell you the size, how big is it? We can tell you how wide it is, and also we can see, are you having issues from that hernia that we can see in the upper GI tract, and should we consider getting this taken care of? So what are the symptoms of a hiatal hernia? Well, there are a couple things. So number one, it can cause really bad acid reflux. So what happens is that when your stomach goes above where it should be, it can trap acid in the upper part of your chest, and that causes the sphincter between the esophagus and stomach to be open longer and more often. So the longer that valve is open, the more likely it's going to be for acid to upchuck into the esophagus to cause really bad acid reflux. And you may know this, you have acid reflux symptoms despite being on acid reflux therapy or lifestyle change. You're still having issues. This may be a sign it could be a hernia. Number two is trouble swallowing. When food gets stuck, it can get stuck actually in that hernia sac. As it goes down the esophagus, it can just stay right here, and you have that sensation of something just getting stuck right here whenever you eat. Number three is that can cause severe pain. Hernias are typically right here. You have really bad pain in this area, and everything else has been ruled out. Your gallbladder, your pancreas, ulcers. It could be the hernia that's causing you issues. And then lastly, it may be asymptomatic. You may not even realize that you have a hiatal hernia because you have no symptoms whatsoever. So now that you have a hernia, or you think that you do, what can you do to help treat this hernia? Well, it really just depends on the symptoms that you have. So let's go through them. So let's say you have bad acid reflux. Well, obviously you want to treat the acid reflux symptoms. So maximal medical therapy can help out. Remember, take your PPIs 30 minutes before your first meal. Maybe doubling up on the PPIs can help out. Try lifestyle changes, losing weight, avoiding acidic foods and trigger foods. But if that doesn't work, then maybe medical options may not be the best thing for you. Let's talk about dysphagia, trouble swallowing. If food gets caught up in that area, we're gonna maybe put you on acid medication to control some of those symptoms, see if you feel better as well. If you have severe pain, the exact same thing. Maybe we'll try medical therapy to see if we can hopefully relieve those pains. If this doesn't work, or you want to get this hernia fixed, the only way to fix this is surgery. Now I have to stress, not every hernia is the best candidate for surgery. It depends on a number of different things. Number one, what your symptoms are and what we're trying to treat when we do surgery. Number two, does the hernia actually cause your symptoms? You'd be surprised how many people assume that just because they have a hernia, it is causing all their symptoms. That is not the case. So we want to do objective testing to find out exactly, is this hernia causing your issues? There's three tests that we do. So first, we start off with an upper endoscopy to see the size of a hernia. Typically, if it's greater than 3 centimeters, this makes us want to think that surgery may be an option for you. Number two, we want to do objective testing of how much acid actually goes up. We do what's called a pH testing, where we can objectively see, is there a problem with acidity causing the issues to occur from that hernia? And number 3, want to see how well the muscles of the esophagus work? It's called a manometry test. This is a test in which we actually see, are the muscles working appropriately? Because if they're not, getting your hernia fixed may not be the best option for you. But if all this fits, you have the right symptoms, you have a good enough hernia, and the objective testing shows that you should get this fixed, surgical treatment is going to be the way to fix your hernias, and there are a lot of different options for surgery to get your hernia taken care of. So I hope this video was helpful for you in understanding exactly what is a hernia, what is going on, and when to get this fixed. If you want to learn more about your hernias, don't forget to subscribe to this channel. Come see us, you're a hernia expert, so we can find out exactly, do you have a hernia? What is going on? Is it the cause for your symptoms? And would you want to consider getting surgery to get your hernia fixed? Well, thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel newsletter and come see us up at Gastro for all your hernia needs. And thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.